In this session of the PEM Fellow Research Design course, we will discuss writing a research protocol for the Institutional Review Board, or IRB. We have completed all the preparatory steps in the research process. We have asked and refined an answerable research question, reviewed a variety of study designs, selected subjects and variables, and determined how many subjects we will need to enroll. It is now time to crystallize all that work into a written research protocol. The goals for this session are to review the roles of the IRB, the types of IRB submissions and submission requirements. We will review the elements of a research protocol and the elements of informed consent and assent and authorization for the use of protected health information. We will review special considerations in the process for vulnerable populations such as children and learners, since these are frequently our subjects. The NYU IRB website has a wealth of resources to guide you through the research protocol writing and submission process. It should be your first stop in writing your research protocol. I will touch on the essential concepts and processes in this session. There are some helpful links available on the main IRB website. These include policies and resources, a protocol and informed consent builder, and links to Research Navigator, which is the web-based software for IRB submission. To submit a research protocol to the IRB, some training in human subjects research is required. NYU requires completion of the CITY program. This consists of one or two basic modules, either biomedical research or social behavioral education research. If you have previously completed this at another institution, it can be transferred to NYU. All investigators involved in the project require CITY training, and it must be reviewed every 3 years. The Health Plus Hospitals Corporation requires on-demand training if the study involves Bellevue patients or facilities. The IRB is responsible for overseeing human subjects research and ensuring adherence to federal regulations. They review new and ongoing research protocols, monitor for adverse events and protocol deviations, and conduct periodic research audits. Federal regulations for human subject research adhere to the 1979 Belmont Report for the ethical conduct of research with human participants. The ethical principles that guide human subjects research include respect for persons, beneficence or do good, and non-malfeasance, do not harm, and justice. We will review how these principles apply to writing a research protocol and obtaining informed consent, and we'll explore these concepts in greater detail in a talk dedicated to research ethics later in this course. In general, research is defined as the use of human subjects in a systematic investigation to produce generalizable knowledge. Now let's look at each of these as defined by the NYU IRB. Research is defined as a systematic investigation, including research development, testing, and evaluation, designed to contribute to generalizable knowledge. Activities that meet this definition constitute research for the purpose of this policy, whether they are conducted or supported under a program that is considered research for other purposes. Human subjects are defined as a living individual about whom an investigator 1. Obtains information or biospecimens through intervention or interaction with the individual and uses, studies, or analyzes the information or biospecimens, or 2. Obtains, uses, studies, or generates identifiable private information or identifiable biospecimens. A systematic investigation is an activity that involves a prospective research plan that incorporates data collection, either quantitative or qualitative, and data analysis to answer a research question. Systematic investigation will involve a predetermined method for studying a specific topic, answering a specific question or questions, testing a specific hypothesis or hypotheses, or developing a theory. Finally, generalizable knowledge is designed to draw conclusions, inform policy, or generalized findings. To develop or contribute to generalizable knowledge requires that the results or conclusions of the activity are intended to be extended beyond a single institution or an internal program. This is part of the form that the NYU IRB provides to answer whether your project is research and does it involve human subjects. One of the questions that comes up frequently is whether your project constitutes research or quality improvement. This is the NYU Quality Improvement Decision Tree that helps to determine the answer to that question. It is not intended that you be able to read this now. It is just a reminder that it exists on the NYU IRB website when you need it. IRB submissions include new protocols, continuations, modifications, reportable adverse events, and study closure. We will focus on new protocols in this session. In reviewing new research protocols, there are three options. The protocol may be exempt and not require a review. And the protocol may meet criteria for an expedited review with only one or two reviewers, or the protocol may require a full board meeting for a full review. Research protocols are considered exempt from review if they do not directly involve human subjects and do not collect identifiable protected health information. However, this still requires a submission of an application for exemption from review to the IRB. Reasons for meeting criteria for exemption from review include studies of normal educational practices, educational testing or interviews except those involving children or for which subjects are identifiable, public database research in which the subjects are not identifiable, public benefit programs, and consumer acceptance studies. The exemption in the previous slide applied to children except for survey or interview studies and observations of public behavior unless the investigator does not participate. Research protocols that do not meet exemption criteria may meet criteria for an expedited review by one or two reviewers. An expedited review is no less rigorous than the full review, but it is generally quicker than a full board review. Criteria for an expedited review include that the research protocol pose no more than minimal risk to subjects. No more than minimal risk is defined as no greater than encountered in daily life and no greater than routine exams or tests. Importantly, an expedited review does not automatically waive the need for consent or authorization to collect protected health information. Research protocols that do not meet criteria for exemption from review or criteria for an expedited review undergo full board review. A category must be specified in a request for an expedited review. Categories 1 to 7 apply to new protocols. These are considered as no more than minimal risk to subjects. Categories 8 and 9 apply to continuing studies. In summary, new research protocols can be submitted for an exemption from review, an expedited review, or a full review. Key questions to determine which type of review is appropriate include: does the protocol directly involve human subjects or collect protected health information? And does the protocol pose no more than minimal risk to subjects? If the answer to the first question is no, you may be able to submit for an exemption from review. If the answer to the first question is yes, and the answer to the second question is no, you may be able to submit for an expedited review. If the answers to both questions is yes, a full review is required. The type of reviews available for continuations, modification, reportable events, and final study closure are included in this table. These are the requirements for submission of a new protocol. The protocol must include a full research protocol and a protocol summary, a consent, assent, authorization form, or a waiver of consent, assent, authorization request, recruitment materials, and an investigator brochure if applicable. In addition, all study personnel must submit a CV, financial disclosure, and proof of city training. These are the elements of a research protocol using the NYU template for an observational study. There are also templates for interventional clinical trials and interventional behavioral studies. The best way to write a new protocol is to review one that has successfully gone through the IRB review. The protocol defines exactly how you will conduct your research. We will briefly review some of the most important elements of the research protocol. Writing the purpose of the study is approached in the same manner as writing an introduction to a research manuscript. Clearly state the problem. A focused literature review should discuss what is known and unknown about the research topic. This sets up the study question, objectives, and hypothesis. The study design should explain how the hypothesis will be addressed and include principal variables and outcomes. The enrollment criteria, both inclusion and exclusion criteria, define the study population. The number of patients to be enrolled should be based on the selected effect size in the sample size determination. The gender, age, racial, and ethnic origin, and the inclusion of vulnerable subjects should be specified. Writing the methods and procedures section of the research protocol is analogous to writing the methods section in a manuscript. Writing a good research protocol completes the background and methods sections of your manuscript. Procedures, tests, and interventions should be clearly defined. It is essential to distinguish between research interventions and standard interventions. For example, a standard intervention for dehydration may be placement of an intravenous catheter and the administration of fluids. A research intervention may be the type or volume of fluids administered. A complete analytic plan includes sample size determination, demographic data, and the planned approach to inferential statistics for the primary and secondary outcomes. A complete analytic plan can serve as an outline for the results section of your manuscript. Methods of data storage and monitoring to ensure confidentiality and monitoring reporting of adverse events should be described. The IRB is looking for a well-written and rigorous protocol. Sound study design should minimize risks to subjects and ensure that risks are reasonable in relationship to benefits. Subject selection should be equitable. The informed consent, assent, and authorization process should be detailed. Methods to ensure data safety, protect privacy and confidentiality, and to protect vulnerable subjects are essential. The IRB can approve your protocol as submitted, conditionally approve your protocol pending minor revisions, defer your protocol pending major revisions or consultant review, for example by a statistician, or a conflict of interest review. They may also not approve your protocol. The consent and authorization process embody the ethical principles of respect for persons, beneficence or non-malfeasance, and justice. Consent refers to an adult or a legal representative agreeing to study participation. Assent refers to a child of decision-making age agreeing to study participation. Authorization refers to permission to collect protected health information. It is important to be able to distinguish these three concepts. The IRB considers certain groups as vulnerable in the consent process and warrant additional protections. These groups are at risk from participating in the study. They may not comprehend the risk of participating in the study or at risk of coercion to participate in the study. The groups relevant to our research are children, employees, and students. Employees include faculty and nurses and pretty much anyone we work with on a regular basis. Students include residents and fellows. Research in children is necessary for research to be applicable to children. Children should be included unless there are scientific or ethical reasons to exclude them. Categories of risk to determine applicability to children include 1. No greater than minimal risk encountered in daily life. 2. Greater than minimal risk with a potential direct benefit. The term direct benefit means a specific benefit to the subject and not just generalizable benefit to the population. 3. Greater than minimal risk with no direct benefit. And 4. Other, not meeting any of the above criteria but may provide a general benefit to the pediatric population. The next two slides present the elements of a full written consent form from the NYU IRB consent template. The questions are written and answered from a patient's perspective. The consent must explicitly state that it is a research project. Many of the sections of the research protocol are repeated in the consent document at a level that a layperson can understand. This is the remainder of the required elements of informed consent. A detailed discussion of each of the elements is beyond the scope of this talk. I will focus on the process rather than the specific content. There are 4 types of consent that can be requested. Full consent, waiver of consent. This is often called verbal consent. This avoids the need for a full consent document and signatures. A study information sheet is required to be provided to the subject. Alteration of consent, in which specific elements of the consent are removed or altered. And waiver of consent. This is rare. This typically occurs in minimal risk studies in which consent is not feasible. For example, in emergency or resuscitation research, which we will talk about a little bit later in this session. The primary requirement for waiver of documentation of consent and altered consent or waiver of consent is that the research present no more than minimal risk of harms to subject. Protocols that involve more than minimal risk of harm to subjects require a full consent. These are the criteria for waiver of documentation of consent. The waiver of documentation of consent precludes the need for full consent document and signatures. This is often referred to as verbal consent. The criteria are: the consent document is the only record linking the subject to the research. The principal risk would be potential harm resulting from a breach in confidentiality, and the subjects will be provided with a written statement regarding the research, or a study information sheet. These are the criteria for alteration of the consent document, in which specific elements are removed or altered. Describe the risks of harm to the subjects and why the subjects involve no more than minimal risk to subjects. Explain why the waiver or alteration will not adversely affect the rights and welfare of the subjects. Explain why it is impractical to conduct this research if informed consent is required, and explain how subjects will be provided with additional pertinent information after participation. Consent should be obtained from the subject or their legal representative. The consent should be written in style comprehensible to a layperson, and the subject should have sufficient time to read and consider and an opportunity to ask questions. The consent process should not be coercive in any manner. A copy of the consent should be provided to patients. Additional copies are included in the medical record and maintained with the study data. Consent is the agreement of an adult to participate in the study. Assent is the agreement of a child to participate in the study. For a child to participate in a study, both parental permission, consent, and assent of the child are required if the child is of decision-making age and capacity. The capacity to assent should be evaluated on a case-by-case basis. Separate assent documents should be prepared for each age category and reading level, usually in the 3 broad age categories above. Federal law allows an exemption from informed consent for emergency research. Emergency consent requires a condition that requires immediate intervention and precludes obtaining consent. For example, conditions such as cardiac arrest or status epilepticus, in which urgent treatment is required and it is not possible to obtain consent. Available treatments are unproven or unsatisfactory. The risk and benefits of the intervention are reasonable, and the intervention may provide direct benefit. There are additional requirements for emergency consent. Prior to the study, the community should be consulted and the project disclosed to the public. In addition, studies with emergency consent should have a data monitoring safety board with predefined criteria for stopping the study. During the study, consent should be obtained from the legal representative or family member as soon as possible. After the study, there should be public notification of the study results. This study looked at consent in a randomized clinical trial of 43 children with acute lymphoblastic leukemia. 100% of the parents were satisfied with the physician's explanation. 81% agreed that the information presented was adequate. 50% didn't understand the aim or benefit of the study. 39% didn't understand the concept of randomization. 33% were unaware that alternatives existed. And 19% did not realize that their child would be participating in a study. This study illustrates that there is room for improvement in the consent process. HIPAA refers to the Health Insurance Portability and Accountability Act. Protected health information is defined as any information related to the past, present, or future health of an individual or payment for that care. Individually identifiable health information include demographics and any information that can be used to identify an individual. A de-identified dataset cannot include any of the following. Note: waiver of authorization for use of protected health information is part of the same NYU form for waiver of consent. These are the requirements for a waiver of authorization. You must identify those who have access to any protected health information, describe the plan to protect privacy, describe the risk to privacy and why the study involves no more than minimal risk to privacy, and explain why it is not possible to conduct the research without the use or disclosure of the protected health information. Investigators are responsible for obtaining IRB review and approval, promptly reporting proposed changes, submitting annual continuation or study closure prior to the deadline, obtaining consent, assent, or authorization as indicated, maintain data securely, monitoring and reporting adverse events, and maintaining an essential documents binder. These are the steps in our submission process. The first step is to submit the protocol to the EM Research Review Committee for review. It is then submitted to the NYU IRB for pre-review, They will assist in correcting anything that would hamper its approval in a full IRB review. It is then submitted to the NYU IRB for exempt, expedited, or full board review. When it is approved by NYU, it can be submitted to the Bellevue IRB if required. On to our questions. Which of the following is not a criteria for waiver of documentation of informed consent? The consent is the only record linking the subject. The study entails no more than minimal risk. The principal risk would be potential harm resulting from a breach in confidentiality. The study subject does not speak or read English. Subjects will be provided with a written statement regarding the research. The answer is D. The study subject does not speak or read English. Patients should not be excluded from participation solely based on the inability to speak English. Study materials, including consent, should be available in the language of the subject. A waiver of documentation of informed consent is often called verbal consent. Any waiver of full informed consent requires that the study entail no more than minimal risk. In response B. The other three responses are criteria for waiver of documentation of consent. A 9-year-old girl with a brain tumor and her parents are approached to participate in a trial of a new experimental device to reduce blood flow to the tumor. In addition to authorization to collect protected health information, what elements of the informed consent process are required? Consent of the parent only, assent of the child only, consent of the parent and assent of the child, or neither consent nor assent are required. The answer is C, consent of the parents and assent of the child. In general, assent should be obtained in those over 7 years of age, though at younger ages this should be evaluated on a case-by-case basis. Assent of the child should be obtained in a language appropriate to their level of understanding. Parents must attest to the assent of the child and consent to their participation. Authorization for collection of protected health information should also be obtained. Which of the following is not considered to be a vulnerable research population? Pregnant women, children, those with diminished capacity, residents or house staff, or all are considered vulnerable populations? The answer is E, all are considered vulnerable populations. In general, vulnerable populations are those at an increased risk from participating, those unable to fully comprehend the nature of participation, and those at risk of coercion to participate. Pregnant women, children, those with diminished capacity, and prisoners are considered vulnerable population. Medical students, residents, fellows, and faculty are also considered vulnerable research populations that they may feel coerced to participate. The next session in the research design course is on writing a grant proposal.